Welcome to Medical Minds. Today we have with us a doctor whose career is as illustrious as it can be. She's an overachiever, a philanthropist, and above all, a very good human being. Welcome, Dr. Rooma Sinha, to Medical Minds.
Thank you. Thank you for inviting me to be here.
Dr. Rooma Sinha is the pioneer of gynecological robotic surgery in India and is one of the most experienced robotic surgeons for gynecological conditions of the country. She has 25 plus years of experience under her belt. And there are two aspects to her career, actually. She uses her knowledge and skills for the to improve the conditions of her patient. And she also invests her time and energy in training and teaching. So, Dr. Rooma Sinha, you balance both very well. And you are currently a consultant gynecologist, laparoscopic and robotic surgeon at Apollo Health City, Hyderabad. You are also an associate professor at the Macquarie University, Sydney, Australia, the director of fellowship program for minimal access and robotic surgery at Apollo Hospitals. And you are a visiting professor at AIIMS Rishikesh. You have published over 40 papers and so many books, and in international and internationally. How do you manage to bring it all together and keep yourself so busy and yet remain so cool and calm?
Okay, let me begin with the cool and calm is only the exterior. Many times there are a lot of things going inside. And yes, I think trying to say balancing everything sometimes can be tough. But we have to think what my priorities are at that point of time, at that day, and how things are just going to go. So I just I have a long-term vision and plan of what I want to do, but I try to take one day at a time. Because if I try to take too many things at one time, then it becomes like I have too much on my plate. So I try today, now after so many years of working, to prioritize what makes me happy. So I have tried to now learn to get the chaff out and concentrate on what makes me more happy, actually. So two things. One is my clinical work in my professional career, of course. And of course, I really enjoy teaching, trying to transfer my skills and whatever I've learned to the junior surgeons and gynecologists. So just taking one day at a time balances me out, that's all.
Really good to know. And you did your MBBS and MD at IMS BHU and graduated with 7 distinctions and so many gold medals. Is there much difference between then and now in the teaching methods, professors, and attitudes of students? I'm asking since you are into teaching big time now.
Yes, there is difference. There is no denying the fact that today, that way medicine is taught is different. It is both good and bad. I'll tell you the goods first. Mm-hmm. Now, when we were students, we were taught everything by hand. If it was available, we would learn. If it was not available, we'd just imagine and learn. Mm-hmm. But today, with internet, with simulations, with things available, students have access to so much knowledge. So that is the good part the students have today. All they need to do is have the will to be able to keep on updating and learning themselves, because there's no dearth of information on the web today. Of course, try to search the right ones. Then there is simulations. Then there are now 3D animations, and there are virtual reality. So I think so much new technology has gone into training medical students, and that's the really good part about it. Like, for example, I'll tell you a very small thing like anatomy. When we were students, when we joined medical college, we had to learn the anatomy. All we had access was one cadaver, where there would be 5 or 6 or 10 students, depending upon where you are. And we would dissect and find something and just learn. But today, the same anatomy to the students is available on a 3D model, on a virtual reality platform. So they can just touch the organ and it comes in by their view, and they can see what it is, where's the blood supply going. So there's so much more fun in learning.
Right.
So I think this, I would have loved to be a student at this time of in time. But the challenges today are that people are shifting from the clinical acumen to more and more, theoretical based things. For example, we were very much into going to the wards, looking after the patients, doing small things and learning hands-on. Today, either the opportunity is not there, maybe the batches are so big that there's so many students, so many few. Many medical colleges have opened which don't have so many patient population. So it's a little sorry part, because clinical acumen cannot be got just by reading. You have to follow your mentors, your seniors, see how they approach a problem, and then you can build up your own clinical acumen in your practice of what you could do. So I think that is slightly missing. I wish that could get integrated into all this hi-fi things that's happening today.
It could be also like a generational change, like you were more, the older generation was more into this. They struggle to become a doctor. Now everything is very easily available. So that could be an attitudinal change also.
Okay, it could be. But I would also say that we had very strict protocols.
Right.
We had strict timetable. There was no question of you could just bypass that and go somewhere else. So we had to follow that. Like, for example, when we were students at IMSBHU, we would have a full day work from, say, 8 o'clock. First class would start at 8 o'clock. It would end at 4. Today, that's when the medical colleges end, mostly. Okay. Unless there are old institutions. But we were then requested, or were expected, to reach back to the clinical ward at 6 o'clock, be there till 9 o'clock. One learning the clinical and the practical aspects of looking after patient, talking to them, doing small things, and then come back home at 9 o'clock and then study for the next day and then be in the ward. So I don't think they cannot do all that. It's difficult to even expect. So they have other ways to learn. I don't say good or bad, but yes, things have changed.
So you also went to get experience at a FIGO fellow at the University of Rochester, USA, and the OGST fellowship at Mercy Hospital, Melbourne, Australia. So you went in for an international perspective. How does that help, and how did that mold your career?
I think it is important to work, or at least observe, at various centers, because otherwise you will remain frog in the well. Whatever you learned, you think, okay, that's what we can do, and that's what happens. But when you go nationally, you could go to other institutes in the country. As today, we have excellent institutes in the country where young doctors could go and learn so many things. Or if you go internationally, we learn a different perspective. Again, I'll say good or bad.
Yeah.
Like, good perspectives we see of how they are dealing with the patients. Is it better than what we do, or are we doing as good? The second is their practices, what they are doing, how they are handling their outpatient patients, in the OR, what's happening, I probably will come to you later in some of the other things that you've been wanting to talk to me about, the wastage of the single-use things that they do in OR in the West, which as a country, we understand from our cultural roots that we should not waste.
Right.
We should reuse. We have been there, but we've just been trying to follow things. So I think, and plus it gave me insight into so many things that we thought that it could happen only there. But we were able to learn, come back and emulate. And today, I think the kind of work we do is at par to any institute you would take across the world. So that perspective was important to me in these short stints that I did. They were very short stints. They were not very long ones. Okay. I, in fact, call myself literally trained homegrown. I have literally trained at home. Because
so we have a homegrown person among us who's so successful, so competent.
Absolutely, because a lot of people, I'm just saying this because public perception is also that somebody who's UK returned or US returned is probably the better doctor, or somebody who has a foreign degree has a better doctor. But I would completely refute that. The amount of, if you have the ability, the kind of clinical work we do and the amount of work we do every day gives us the clinical experience to actually do any level of work across the world. So that is not always important.
So, and related to this, I wanted to ask, there's so much of increase in the gynecological issues in young girls right now. I mean, is it right now, or is the awareness more right now in India?
Both.
Okay.
Okay, awareness is definitely more because people have access to medical knowledge. Like even the girl in, say, Muzaffarpur can put a phone and Google immediately if she's having a problem. What is it, right? So that access was not there to girls or women across the world before. So they had a problem, they would ask the neighbor or the grandmother or the mother or mother-in-law, and they'll say, okay, this happens, deal with it, and it'll go away. That's how it was going. But women are more aware.
Yes.
They want to Google, they want to find out, they'll go to the doctor, they'll take online consultation or do something. So awareness is important because that helps them not to disregard the problems that they have. But many of the problems, even as a gynecologist that I face or I deal with, is lifestyle issues.
Oh.
Okay. So a commonest problem, and a lot of people, I'm sure you must have also heard about PCOD or PCOS.
Yes, yeah.
Right?
Yeah.
I have all the time women and girls walking into my office and showing me an ultrasound report and say, I have PCOS. I said, okay, sit down. Don't tell me the diagnosis. Tell me what your problem is. So we have to start from there. And a simple thing like PCOS, which so much hungo about everywhere, is actually, if you look at it, is a metabolic disorder.
Oh,
okay. Now, let me explain. Metabolic disorder is something that would happen in diabetes. So a PCOD patient has a similar genetic makeup of a diabetic patient. And when we take history, we understand that they will relate to somebody in the family saying, okay, my mother, grandmother, somebody had, and they say, oh no, 60 years. But doesn't matter, the genetics is there.
Yes.
All right. Genes have been there in our society, in Indian population for long. Why it was not happening earlier? Because the lifestyle was different. Young girls were playing. They were eating home-cooked food, right? Their weight was in control. Today, the young girls are either in front of the television or their phone or sitting in the school. There is no playground. If there is not happy with what mommy cooked, Swiggy is there.
Yes. Agree.
So the metabolic error has multiplied. And then they come to a gynecologist saying, I'm not getting my periods for 3 months, do something. I said, okay, I can do that. But you have, the ball is in your court. You have to remain healthy, right? So I think both. So they have got aware, so they will come to us, but they don't understand that changing their lifestyle, changing their dietary habits, so many things, even if you look at fertility issue, right? See that infertility centers are mushrooming. Every corner has a...
Yeah. I mean, I've gone through small towns and I see fertility centers there, which really amazes me.
Yes. So what changed in 20 years that pehle people were getting pregnant now and they can't?
Yes.
Right.
Nice.
Body mask. Like they are very delicate thing, but see, people are busy with other things in life. They don't have the time for the regular stuff. And then they think, okay, now we should start a family. The first thing they'll say, okay, let's go to the fertility clinic.
By that, they need to kind of too late to be.
Yes. No, I wouldn't say too late either, but the focus has changed. We have to inculcate and I deal with women, so I would like to talk to women today, that inculcate the good lifestyle habits. Some kind of exercise. Earlier, exercise was part of their routine. They'll go walk to the market, buy vegetables and come. Then they will make some masala and then sit on the ground and make food. See, that was all physical activity. Today, you have blanket, you have oven, you have mixie.
No need.
No bad, not bad. It's good. But then you have to go to the gym to exercise.
Yes.
So either you put it in your regular day-to-day activity or you do. So exercise, eating the right diet and maintaining good weight. These are the only 3 things if we follow, most of the gynecological problems also will go away.
So I have a question, Dr. Rooma. So, like you talked about fertility clinics and the mushrooming of fertility clinics, and you're leading it to lifestyle issues, of course. But, like there's a school of thought that there are fertility issues because women are marrying later and they're planning a family much later. So is there any truth to that perspective?
Kind of.
Okay.
Yes. If you look at the right age to conceive and become mother, biologically, it will be somewhere between 25 and 30 years.
Okay.
Okay. Beyond 30 is also okay, but beyond 35, anyway, we know that the eggs that are there gets over aged, and then there are other problems, and those can happen. Yes, you are right in the way saying that now we can't expect our kids or girls to get married at 22, 20,
Yes,
and have a child by 28. It doesn't work that way. But not everything is just because of this. There are other factors that are coming in, and as I said, the lifestyle and the obesity and high weight and not eating the right food, not having exposure to sunlight. There are so many things that if you really actually look into it, it makes sense today. And everything does not have a medical answer. So even if this fertility clinic, and if I have a problem and I go there and I'm trying to take help, the medication or the treatment that they are going to give won't work unless my body is receptive. Okay, so magic kahin nahi hai. We have to have
in your attitude to live healthy, right?
It has to be a give and take between the women and the physicians that we can help them. You are right that when people delay childbirth, there are not just the problem of their other things. There are other problems like, women can develop fibroids or endometriosis. So as you age, these are becoming more and more tougher problems to handle. And these could also be responsible for your getting difficulty in getting pregnant. So I'm not against the fertility clinics. They are good. They can help. But as a couple, one must see that if they can make some difference before taking the path down that.
Okay, so you are saying like couples just walk into clinics without taking the path? I mean, that is really...
Because they are desperate. See, okay, I'll tell you the average couples who walk into our offices is, they have been probably married for 4 or 5 years by now, but they're busy. They said we were not financially stable, or we were pursuing our career. Now we decide to have children. Okay. When did you start? 1 month back.
Okay.
What shall we do? So if you look at the biological aspects, any couple wanting to get pregnant should give at least 1 year's time on a natural conception cycle that they will get pregnant if they are not using contraception. But now the husband is already 38, wife is 34 or 38 or 36. And then, then our responsibility also changes, because I can't tell them, ek saal wait karte raho. There might be something else going on there. So we have to evaluate them. We have to tell them. And then that's the problem that it starts.
Okay. Got it. So there are many challenges in your specialty. And I guess one of the biggest one is like, changing the attitude of your patients, making them realize that they are the ones responsible, and they have to become a better versions of themselves.
True.
What are the other professional challenges?
See, professional challenge number one, I would say, is it's a tough job.
Yeah, it is, especially gynecology.
For the simple reason is that not gynecologist, any medicine, you can't let your guard down at any point of time.
Oh, right.
Right? Because see, you or anybody walks into my office, or anybody is in my operating room for me to do a surgery. For me, it is a day's work, right? It's all in a day's work, or maybe, but for that person, it's 100%. I make an error or I have a problem. For that person, it becomes 100%.
Right.
So all the time, I can't lose my focus. I have to be 100% on my job.
Yeah, like other careers, you are.
I can't take a break also.
Yes.
Like supposing I'm doing a surgery and it takes 4 hours, I can't say, okay, 5 minutes, I will go and come. I can't. I can't even take a washroom break.
Right.
So these are challenges which got inculcated to us because we had very tough teaching schedules. Like I told you, grueling. Morning to afternoon, we are there again 3 hours, you go and then come back. So that kind of gruel does that, there is no respite. Okay, we need break, we need rest. I don't disagree to all that. But when you are on the job, you can't lose your focus. So that is the biggest challenge I face, and I think is important. Other than that, dealing with difficult problems both ways. Sometimes you have problem is simple, but the woman may be very difficult to handle, right? Socially, or the medical problem is tough. So we must remember I have at least taken these 2 or 3 things in my mind always, that if I am faced with a tough problem, to deal with these tough issues, I've always tried to upscaling myself, upgrading myself, re-updating myself, so that I am at worst with in work with the latest things that are available, so that I can offer to the women for that. Second is always work with 1 or 2 more people as a group.
So you should have a team.
Team, yes, because nothing is achievable without a team. You grow with your team. And the team is not just another doctor or 2 or 3 more doctors. The team includes my nurses, team includes my technicians, team includes even my secretary who's handling my patients. So a good team will give the best clinical outcome and experience to the woman who wants to come to us. So I have believed in that, and I have worked very hard to make that happen.
You talked about team, and so rightly so, because I've read interviews of so many and heard interviews of so many successful women, and all of them say, like, we are successful because we built a good team in place. That team becomes our support system, also our backup system, also. Yes,
so professionally, you have that team. You can transfer your skills, delegate, so that you know at that level things are happening. Then you need to, because everybody has only 24 hours, and you need to sleep as well. Then you have a backup team, and rightly said, as women, we need a backup team back at home, where the family and the other people. So other than creating a professional team, I've created a team at home also.
Yes.
And those some of them have been with me for 20, 25 years now.
So they are practically family now.
They're family, and I treat them like family. So I don't have to even blink or think what they're doing. I just know that if they come, that part of work will be done. So when I reach, it's done.
Yeah.
It's just small blessings, that's all.
It's all about management too. You are a good manager.
Yes, it takes a lot of toll in managing these things. You rightly said so.
So we know that patients make you smile. So let's go to some fun aspects now. So have there been instances when you wanted to laugh aloud when a patient said something and you had to keep a straight face?
I know, I have actually been thinking about it, but really, Sangeeta, when they come, we cannot laugh. Or there's really nothing that they tell me that makes me, because, I don't think that anything that they tell me is not of importance. Sometimes we have even patients who come to us, they will tell 5 or 6 problems, but I understand that in the background, she has some other issue going on at home, which she just wants to blurt out, So we get the time, and I said, okay, keep on speaking. And some of them become my good friends, and they will share all the other things happening in their life. So those are sometimes very funny instances. But what makes me smile is basically sometimes when if I say something and I connect with them, that could make a difference to their life, makes me smile. So it's not just always that I have treated and became better, or I did a surgery and the outcome was good, I'm smiling. But if I could connect with them, and especially I'm telling you with the younger kids, younger girls, when they come to me, like in teenage and up to 20s, I talk to them very simply without being any judgmental. Because life has changed. What we were in our 20s, they are not in their 20s anymore. So there's no point being judgmental. But I like with a smile when I try to connect with them and give them the information that they need to have to be safe, be protective, be so many other things. So those instances really, I think I'm blessed because I can probably make a difference to them. And they might listen to me because it's coming from a doctor, I suppose. I hope so.
That is why their parents send them to a doctor in the first place. Yeah. So now we'll have a quick question answer session. So
sure.
Sentences. So this section of our show is called Being Human. So I'll just ask small questions. So being a doctor by itself is a full-time job. How do you manage work-life balance, being a mom, daughter, wife, daughter-in-law, so many roles?
I have been asked this question a lot, and I've put my mind to it, but I think I've stopped balancing. I've started blending. Simple. The difference is that every day, if I try to do everything, I can't.
Right.
As I said, day to day, I prioritize. Today, if I think I have a family issue which is more important, I'll put my professional work at stand or delegate to somebody, and I tell my patients, see, today I'm not available. This is more important to me. And then I do the same other ways. So I'm trying to blend what I can do in my profession and personal life together. I had this problem when I started because I wanted to be the best at everything. And I realized it was too stressful. I can't be the best doctor at home, in the work, and then come home and the same day be the best mother, best mother-in-law, best wife. I cannot. I realized that was taking me too much toll. So I started blending more than balancing.
Great answer. So are there two worlds in your specialty? Are rural problems different from urban?
See, the women is the same, right? Problems are similar.
Right.
Some of them may differ because urban women might today have more of, as I said, lifestyle issues as compared to the rural women. Rural women may have more nutritional issues as compared to urban women. Because their nutritional value is low. If you go and look for hemoglobin in the rural population, find more percentage of patients having, or women having, low hemoglobin as compared to urban women, right? So the nutritional value has changed. I think the mental space, I would say, I wouldn't even say mental problems, but mental space is quite different between the two. Women in general have a lot of mental health issues, in general, more than men. And we need to recognize them. As a gynecologist, I always keep one antenna high, that whatever are they talking to me, is it related to something that is disturbing them mentally, and address to that rather than just on giving on medications. So the mental space that urban and rural women have is slightly different. And we need to be sensitive to that when we are dealing with them.
So what is one thing that you would change in your current setup if you could?
See, I'm basically today, after so many years and doing so many things in gynecology, is now a hardcore gynecological surgeon. My days from morning till evening is spent in operating room. Yes. I have actually been thinking, and I'm almost thinking of taking it up as a small project, is to actually improve sustainability.
Oh, wow.
I'm serious about that. Because I always see, when I enter the operating room, I see how much of waste have we created every day. Hospital actually is a place where waste and pollution from the waste that is going out is much more than airline, automobile, or anybody. But everybody talks about that and nobody talks about hospitals. And the maximum amount of waste that generates in an hospital setup is OT. So in my own small ways, I've started making differences of how we can reuse things. Like in my operating room, I've made clear instructions that I do not want always disposable sheets, because they are plastic sheets. They are sent back. They're either burnt or they will be in some landfill. We were using linens earlier. Why not? We can use that if we can autoclave them well. Right. So small things which we can reuse. We can actually take some research projects and say, okay, this is not making a clinical outcome difference. Why we can't, apply this? Weights. Simple thing I teach all my students: when you are washing your hand, please do not keep the tap on. There's a tendency because we have to wash for 2 minutes. So waste water. So sustainability is something, if I could change in my lifetime, I think I'll have achieved something. That's my next thought process in my workplace.
So as a gynecologist, do you get called for urgent operations, emergency operations often? So where do you keep your phone at night?
Okay. So if you look at gynecology, we have basically two parts: obstetrics and gynecology. So the obstetrics are the people who are dealing with deliveries and that. Well, that is, you can get called at any time.
Yes.
Which last 10 years, I have delegated to a team. So my team does that work and I don't. I do only surgery. So I don't get calls in the night unless there is a crisis. However, said that, my phone is always next to me. For the simple reason that, again, as I said, if one patient is looking for me, and actually in crisis and I'm not available, it's 100% for her. Although my, again, delegation and team is so good that I don't get any call for any appointments anymore. They all understand that if I talk to Dr. Rooma and I reach without informing the secretary, then I might have to wait for 2 hours because secretary has given the appointment. So they learn. But my phone is always next to me and it's on 24 hours, unfortunately.
The first thing that you do in the morning?
Well, I used to look at my phone the minute I used to get a few years back. But COVID taught me that look at the phone. First, thank God that you are awake today. You woke up. That was the
It
first
your
thing.
attitude.
Yes, changed. And I said, okay, thank you. I woke up today. And then for a minute, I'll think, and okay, everybody around me or whom I care for is also good and in a safe space. That really is a kind of gratitude I really think about it. The second is I will think, okay, what's my schedule today? Because that will make me jump out of the bed. Otherwise, I'll say, oh, aaj kuch kaam hi nahi hai. And then, like my daughter always laughs at me. You cannot lie on bed or you cannot do nothing. But the next I'll think is, okay, what's my schedule? What's happening today? And that's I just start off my day. That's all.
So, Dr. Rooma, we are running out of time now. So I want you to give a message for your fraternity out there and then a message for the women out there.
Okay. To my fraternity, especially to the junior ones that are coming up, I would suggest that, treat women with respect and empathy. That's very, very important. Give them time to listen to what they have to say. It may be just 2 or 3 minutes. Don't cut them out because they don't get an option to speak many places. Your office may be the safe space for them to open up. Give them absolutely, respect to what problem they have rather than the reports that they have come up. This is again an attitude which in the last several years I have picked up. That when they come and say, they'll give you a big bundle, this is a report, this is happening, this is happening. I don't have to treat the report. I said, okay, close that. Tell me what your problem is. So this is one message I would like to give to my fraternity as well, especially to the junior ones, that, look at the woman at a whole, see what you can make a difference for her. Your 5 words can make a lot of. Medicine is one, but we have the capability as gynecologists to actually get into them.
Yes.
And become, yes. So that's what I would like to say. To women again.
About asking them to give, time, because generally when you go to a doctor, they are on a very strict timeline.
Shouldn't be. Yeah. Shouldn't be. I think those days are gone. Then I'll say, okay, I saw 200 patients. I can't. If I see 20 also, I'm tired by evening because I give time to them. Yes. I think it is not right. Not right to the person who has walked into your office.
I think, and in the long run, it makes a difference because the word of mouth spreads out about that the doctor gives you, is good and you get organic.
And you tell me as a common person, if you enter a doctor's office, what do you want? You don't get time, right?
Right.
Correct?
I remember because especially, like when I used to take my mother-in-law, even my mom now, when the doctor talks to her, when she comes out, she's so happy. I mean, she's, So it's like, even if she's not cured, she's happy and she, has a lot of praises for the doctor.
Many times we don't have the cure.
Yes.
All we can do is that what we call as TLC, tender loving care. Just give them some positive words and they will be okay for a few days. That's important. And to the women, I would say first thing is don't ignore your health issues. Women have a tendency to come back to their health after everybody's health is taken care of. Right? Don't do that because if you are not healthy, you can't take care of it. It's like airline rule. You have to wear your mask first before giving it to your next door or your child. If you are not healthy, you will not be able to. So small things. And today, as I said, information is available in the web. You have online consultations which you can do. If you can't get out of home to reach a clinic, you can do an online consultation. So good health is always in your court. If you play tennis, I can only give you a return, but ball will come back to you. So if you can catch that ball and keep it to your health, I think we have won half the battle.
So prioritize your health is like this message that goes out. Yes. Thank you so much. Thank you so much, Dr. Rooma, for your time.
Absolutely. Pleasure. Thank you so much.